All right, so what exactly causes it? Because most of the time we hear these cases mostly in adults, like people of older age, I would say. And most people would say, oh, well, that is because they're aging. I mean, they're also probably some of the organs are starting to shut down slowly.
Actually, yeah. Actually, there's no age within cardiology anymore. So
Yeah.
even in England, I had a patient, I remember that she was 99 years old. And she came with a heart attack. She was very otherwise, she was very healthy, and she wants to live until at least she become 100 and get a telegram from the Queen. So actually, we did an angioplasty. We opened the artery, we put a stent, and she managed very well.
Okay.
So there is absolutely no age limit. If the patient has the ability to accept the treatment and we know that the patient will take the medication, we will certainly try to open the artery which is blocked. There are certain factors which actually affect not only elderly people but even young patients as well. So high blood pressure which is not treated well, that's a risk factor to have a heart attack.
Okay.
High cholesterol, which is a lot of blood fat because of the food we're eating, because of the takeaway from Kentucky or from other restaurants with chips. So that will increase our cholesterol, and the cholesterol in the body, it goes to a certain limit. When it passes that, then the liver cannot maintain the fat. So it will go into the arteries, coronary arteries, and then start to cause atherosclerosis.
Okay.
There is diabetes, smoking, alcohol. So all these are common risk factors. So if anyone have those risk factors and complaining of a chest pain, he has to see a cardiologist as soon as possible.
Okay. Now, in terms of the limits, what is the limit exactly? And I'm asking this in terms of the food that we eat, because people would argue and say, for instance, the chips, and let's just say unhealthy foods. Some people might say, well, but I take it maybe like once in a week or twice in a week, so probably am I on the clear, or am I still at risk of developing heart attack and eventually heart failure? So in terms of the limit, what exactly is it? And depending on the food that you eat, let's say like once in a week or probably twice in a week, will that have an effect eventually on you developing heart attack and heart failure?
Well, it's not only what we eat, but some people and some families, they genuinely have high cholesterol because they are lacking some of the enzymes. And we can see that the whole family, that they are affected by heart disease or acute heart failure, acute myocardial infarction, and then it goes in family because they lacking the enzyme which actually will destroy the cholesterol.
Okay.
Other people, it depends on the stress. We have acute stress and we have chronic stress.
Okay.
Stress, generally, it will affect the metabolism of the cholesterol metabolism in the body. The lack of exercise is very important factors. And even before I start to tell the patient what to eat. So I always ask him about exercise. So if you have a lot of stress, you have to neutralize that by increased exercise. And when we talk about exercise for the heart or the cardiac exercise, it's 45 minutes, at least 5 days a week.
Oh, wow. Okay.
So that's the thing that we can keep our heart and our cholesterol level low. But again, back to your question, what is the best level for cholesterol? And I will tell you that there is no limit.
Okay.
If the patient have cholesterol at 5, for example, and he had heart attack, we have to lower it to 3. If the patient have a high cholesterol at 7, then we have to lower it below 5.
Okay.
So it's relative, but normally I would say any cholesterol above 5 should be treated before it happens and it leads to heart attack.
Okay.